One of the things that has become so frustrating, so exhausting really, when it comes to the coronavirus conversation in Canada and the debates around whether or not there should be more lockdowns or fewer restrictions, should we lock things down, open them up, and so forth, is the level of information that some people are working with, and how I would posit that the lockdown advocates that I have heard from, the people who correspond with me, write things at me on Twitter and so forth, I've really got to say, I'm not trying to insult people here, but we're dealing with a lot of low information voters. It is surprising to me how there are basic facts that have not been accurately communicated to the public. And I guess one can blame people for not doing their own research and so forth. But look, folks are busy living their lives, working their jobs, taking care of their families and so forth. I mean, a lot of the blame I got to lay squarely at my colleagues in the broader media sector, in the way that they have been not properly communicating a lot of these rudimentary facts that it's so important for people to know. One big example, I write a lot about the schools issue and coronavirus in kids, what pediatricians are saying, and oh, by the way, pediatricians are pretty much all saying schools need to remain open. And I get a lot of tweets sent my way or emails sent my way from a lot of folks saying, well, maybe the school should close down because, even if one child dies, it's too many, or, we don't have the children dying and so forth. And I go, well, I got good news for you. One child has not died of coronavirus in Ontario. There's not a single case of a school-aged child in Ontario ever dying of coronavirus. The statistics show that there is one girl who died of it. Toronto Public Health was explicit that coronavirus was not the cause of death in her, that she just had coronavirus, but it was not the cause of death. I think a lot of parents would also breathe a sigh of relief to hear all of that. They need to be told that information more. I think a lot of people would be confused by it. There's been public opinion polls in the UK and in the US trying to gauge what people actually think is going on. And those polls find that most people have a far more alarmist view of what's happening. When you ask them about risks of hospitalization, death rates, and so forth, they overestimate all of it, and by a great degree of magnitude. Here's another statistic that a lot of people probably aren't particularly aware of in terms of the number of coronavirus cases that have been attributed to retail spread. The number when I last wrote about it was 0.1%. That's in Ontario. So that's the number of coronavirus cases directly attributed to all retail, all across the province. So whether you're talking about Loblaws or LCBO outlets, liquor stores, that kind of thing, 0.1% of cases. And that is not just the shoppers going about. That includes people back in the stockroom, the employees having prolonged close contact in the back room, having their lunch or what have you. That includes those numbers as well. I think a lot of people would be surprised to know that public health officials, when you listen in great detail to their press conferences, and I know they can be boring, but you sit down and you listen to the whole hour-long thing or what have you, they talk about things like mobility data. So when they like to close things down, they're not even closing them down because they believe that they are causing coronavirus spread, but just by closing those things down, you are limiting the number of places that the number of excuses and reasons people have to leave the house. So you shut that thing down just as another way to keep people home, to sort of drop mobility in that city or province or what have you. And again, I think people believe that when places are being closed down, it's because they're attributing very dangerous spread to those specific locations. So therefore you need to be afraid of your gym, or you need to be afraid, of the boutique bookstore or what have you, even though that isn't even the reason why public health officials are really actually closing them down in the first place. A lot of rudimentary kind of 101 information about what's happening that I just think my colleagues in the media have done a really poor job of highlighting. I think because of that sort of failure to communicate, I think that's one of the reasons why we have people who are advocating and really pushing for some wild policies that maybe are not actually the most productive path forward.